Hey everybody, we're gonna talk about filler basics for a few minutes. So if we're gonna talk about fillers and why we use them, we really have to go back and understand what happens when we age, and that really helps us understand what we can do with fillers and why we use them. So when we age, the three main things we really need to think about are number one, the bony structure of our face changes as we age, so it gets smaller and less supportive, and also the shape of things like our eye sockets and whatnot will change, and that really aids to give us an aged appearance to the face. Number two, the skin and soft tissues will start to sag and they'll start to droop. And this change just because of the effects of gravity, and over time the composition of the skin itself will change, and that will give the kind of telltale signs of aging along the face. And number three, the biggest kind of paradigm shift and change of how we treat the aging process is volume loss. And so when you're youthful, you have a lot of full fat compartments in our face, and as you age, those compartments start to lose volume, and then that volume tends to sag and fall down with gravity over time. And so a good way to kind of think about this is that you have nice and full cheeks when you're young. Look at babies, they have really nice full cheeks. And over time, that volume will also decrease from the cheeks, but it will also fall. And it'll start to come from up here where you're nice and projected, it'll start to come down here. And so when you really think about that third component of volume loss, that's where something like fillers really come in. So before fillers were introduced, people were using things like fat, so using fat grafting as a filler, which gave a more permanent result and was giving a very nice result and something that's still used commonly. But then all of a sudden, once hyaluronic acid fillers started coming onto the market, all of a sudden you had a product that worked really well, you could do on an outpatient setting and give some immediate results. So let's talk a little bit about what fillers are. The majority of fillers, when you hear that word, is really talking about hyaluronic acid fillers. So hyaluronic acid is basically a type of sugar, and that is actually naturally found inside the skin and soft tissues in the body. So what you're injecting is actually something that's found naturally inside the body. The chemical composition of the filler that you might be selecting varies widely between the brands and the type of products that you have, and that's a little bit more in-depth of a discussion than we're going to talk about right now. But hyaluronic acid is the basis or the majority of fillers that you're using to revolumize the face. Again, there's other types of fillers that you can use. So Radiesse is a calcium hydroxyapatite, something that's not a hyaluronic acid based. And then there's other fillers as well, like Sculptra or those things like that actually try to generate some new collagen from your own body over time when you use them. But really, the important thing to know about fillers is that they're made from hyaluronic acid, which is a type of sugar, and they're injected either into the skin or just under the skin to provide volume. And so what you're really treating is you're treating volume loss. And so that really leads to the next question that a lot of people either have some confusion about or they tend to ask a lot. You know, they ask, can you put filler here? Or can you do Botox here? And it's really important to understand why we use Botox and why we use fillers. So Botox is really used to treat lines and wrinkles, but really what you're doing is you're treating the muscle underneath that's giving the appearance of wrinkles or fine lines. So when you contract the muscle, it's going to pull on the skin and it's going to cause those wrinkles. So Botox will go and effectively cut out the activity of that muscle, and it'll treat the wrinkles and the fine lines. That's different than a filler. So when we're using fillers, what we're trying to do is revolumize. So in certain areas, if you have a deep line here, or you have a sagging descended cheek here, we can fill those areas with volume again to give a more youthful and rejuvenated appearance. So the whole point of using a filler is to revolumize, and the whole point of a Botox and neuromodulators is to knock out muscle activity to cease those wrinkles or fine lines that you can get. And so now on the market, we have tons and tons of fillers. There's a lot of options, a lot of different products, and a lot of confusion for providers and people who are starting out, and especially consumers, why someone might choose one filler over another. The discussion of rheology, which is basically kind of the science of what fillers are made of and their chemical properties, is very in-depth, probably beyond this Instagram discussion. But some of the things to think about is that the filler products themselves vary widely in how they're made and what the chemical composition is. In general, there's fillers that are really good for lifting and volumizing. So if we want to volumize the cheeks and try to lift it as much as we can with a filler, then there's certain products that are really good at that. They're really good at being supportive and filling out certain areas. And that's different than something that you'd really want to use around the mouth or in the lips, something that really is going to move a lot more than something like in the cheeks or in the temples or even in the nose. We really want structure, and in those other areas like around the mouth or in the lips, you really want something that's going to be integrating into the tissue a lot better, a lot more flexible, a lot more movable, so that when you move, it's going to move with you and not show through. And so the key to really treatment with fillers is basically the facial analysis. So, anyone can really inject fillers. They can learn how to inject a certain area with a technique. But the real skill of treating with fillers is looking at a patient, seeing what they need, and seeing that specific area is going to look good with some filler in that area. You don't want to fill everything. That will tend to give a really overinflated, wide appearance that doesn't really look good and it doesn't look youthful. So the real skill and experience is knowing where you should inject someone and where they're going to get the most bang for their buck with the filler. The treatment with fillers is in the office. It's done with local anesthesia, usually just a little pinpricks with numbing medicine, or the products themselves typically have lidocaine in them. So when you go through the procedure, you're getting actually numbing medicine while you're also getting the filler product injected. It's possible sometimes to get a little bit of bruising. Usually it's very minimal to none, and you will have some swelling depending on the product that's used. But once that subsides, you can go back to work same day, and you can resume your normal activities. So it is really a nice technique that has really minimal to no downtime to do. And in general, I guess a couple of things you can run through is just some typical areas that you're treating with filler. Common areas that are involved in the aging process that we tend to use filler for from the top down. Sometimes people will use them to kind of get a little lift in the brow, forehead contouring. As you age, you get really volume loss here in the temples, so we can inject filler in there to revolumize the temples. You've probably seen or heard that people are injecting the nose to do a non-surgical rhinoplasty, so you can somewhat build up the nose and change the appearance of the nose. And then again, you have the cheeks in the mid-face, the tear troughs here that you can fill that lose volume, the nasolabial folds, the marionette lines, and also then again, people are augmenting their lips and doing those kinds of procedures as well. Jawline and chin, as well as a very commonly filled area. So in general, that's kind of the basics of fillers, how they work, where we would inject them, and why we use them. If anyone has any questions, please let me know, and thanks for watching.